Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and I'm in Dyersburg, Tennessee today, talking with Dr. Rauf Baba. He is a endocrinologist at West Tennessee Medical Group Endocrinology in Dyersburg, Tennessee. Dr. Baba, how are you?
I'm good, Will. How are you?
I'm great. Thanks for coming on today.
You're welcome. So I'm here for the last 20 years or so, working in Dyersburg, and I also work in Jackson. I basically graduated from University of Kashmir, which is northern part of India.
Okay.
And I did my residency in 97, so 3-year residency in New York at NASA University Medical Center in New York. So after that, I did my fellowship 2 years in the same center, and I've been here since 2002.
You ended up in Dyersburg.
I don't know how I ended up. Patients still ask me, it's a
Right.
shocker. I said, I don't
Sure.
know. I thought we'll see how it goes, but I never, left the town. The more I saw these patients, the more I thought, I like it here.
Yeah, that's
it's a
great.
different, laid-back lifestyle.
That's great. Well, today we're going to be talking about thyroid symptoms and thyroid issues. So I guess my first question is, what are some issues that people can have regarding their thyroid, and what should people look out for?
Yeah, I see a lot of patients with diabetes, but there are many more thyroid patients. A lot of patients come with some vague symptoms. Hey, I don't feel good. I feel tired. I feel like I'm gaining weight. I'm doing my diet, but I'm still gaining weight. Or I feel cold all the time, or my hair is falling. Especially women, they will, when women complain about hair loss, that's a serious issue. Because
Sure.
So these are some of the symptoms. So weight gain, fatigue, and hair loss, and all those symptoms. So that's what they come for.
Okay.
With the symptoms, yeah.
Gotcha. So I've heard the term hyperthyroidism and hypothyroidism. What are the differences in those two?
See, thyroid is an important gland in your body. It's, when a lot of patients come to me, they'll say, I have something in my neck which is just low, just below the chin. They say, what's that? Is that my thyroid? Which is usually not. It's Adam's apple. I
Sure.
say, no. Then I examine them and I tell them what exactly the thyroid is, which is at the lower part of the neck.
Okay.
So this gland basically is an important gland because it controls everything. It controls your metabolism. So if it's slow, it's not making its, I tell patients, it's not making its juice, it's not making its hormone. So it's called hypothyroidism.
Okay.
But if it's overactive, it makes too much, 2, 3, 4 times more than it should, that's called hyperthyroid.
Gotcha. Well, that makes sense. Like if you're hyper off of coffee, it's because you've had a lot of
So
coffee.
the symptoms are totally opposite,
Okay.
two opposite poles.
So could you tell us a little more about hypothyroidism?
Yeah, so let's talk about hypothyroidism, which is when the thyroid hormone is underactive. So we call it underactive thyroid.
Okay.
So basically, it's incidents. It's very common when I see my patient. Every other patient talks about these symptoms, but it's still overall about 0.1 to 2% overall incidence. But in females, it's very common. Especially women over 65, they are like 5 to 15% is its incidence. And there's a type of hypothyroidism where it is kind of borderline hypothyroidism. We call it subclinical hypothyroidism, which is even more common. It's almost like 4 to 10%. And at any rate, it's more common in females, about 4 to 8 times more common in females. They have more thyroid issues than men have.
Okay. So what about hyperthyroidism?
Hyperthyroidism, it's less common, but patients usually come with, weight loss and shakiness. They have heart palpitations, and they are overactive. But it's not as common as the other one. So going along with the hypothyroidism, a lot of patients come to me, can we rule out hypothyroidism? Do I have thyroid issues? So if they have symptoms like we mentioned, weight gain, fatigue, tiredness, or feeling cold, constipated, dry skin, or women, they have menstrual problems, so they should be checked for thyroid issues, especially hypothyroidism. Otherwise, there's an association, American Thyroid Association. They recommend hypothyroidism to be ruled out or check the thyroid for people around or over 45 years.
Okay.
So screening is kind of, it depends on, if the symptoms are really telling the doctor that, we should look into the thyroid problem, hypothyroidism. So that's where, you check their labs. So the most important lab to go by is a TSH. It's a thyroid stimulating hormone. So if it's normal, then the patient is told that, it's not your thyroid, something else is going on. If it's off, then the patient needs treatment for hypothyroidism.
Gotcha. Is there a certain age that thyroid issues tend to present themselves in different people, or can it happen really any age?
Yeah, hypothyroidism can happen at any age, but it gets more, the incidence is more as we get older, especially in women. Like I said earlier, in women over 65, it's as high as 15%.
So I've heard that issues with your thyroid can also simulate maybe depression or anxiety. Is that correct?
Yeah, that's correct. And there's a lot of depression in patients with thyroid. Let me tell you a story.
Sure.
When I was doing my fellowship in New York, it was 2001, 2002.
Mm-hmm.
I was in CCU, coordinated care unit, and I was on call. It was night, and they brought in an old lady, like she was like 85 or so. She was brought in coma. She was cold, and her blood pressure was low, and her blood pressure and temperature, they were really low. So she had nobody with her, and so we had to talk to her neighbor. So it turns out it was cold. It was winter months that time. So her neighbor was checking the mail, and then she realized it was snowing. So she realized that this patient, the neighbor, hasn't checked her mail. So she looked in her mail; it's all full. So you're like, what's happening there?
Sure.
So she went and knocked. Nobody answered. She broke into her living room, and this patient was on the floor. She was cold, or she was in coma. And when we went to history from her family member, she was supposed to be on the thyroid hormone. She hadn't taken her thyroid medicine for days and days, and she was in coma and she was cold. All those symptoms got exaggerated, and she ultimately didn't survive. She died after a few days. This was because she had missed her thyroid hormone.
Oh, wow.
But psych symptoms or psychiatric disorder or neuropsychiatric symptoms they can have, it can range from depression to anxiety, but most common is depression. Patient can come with depression. I had, like yesterday, even today, this morning, I asked patients who have thyroid problem. They told me that, I've been depressed. There was one patient yesterday, she said, no, I'm fine. Like, okay, that doesn't make sense. But I realized she was already on antidepressant.
Oh, okay.
So almost, it's very common for these patients to have depression. So it's 40% or so they see. And the good news is once we treat their depression with the thyroid hormone, some of them they need antidepressant. 40 to 60% depression gets better.
That's great. You mentioned treating the hormones or treating the symptoms. What is the fix or the treatment for thyroid issues? Is there a pill they can take?
Yeah, when you have this hypothyroidism, what we talked about, which is underactive thyroid. When we tell patients, hey, this is a good news, they say, what do you mean good news? I'm going to be on medicine. How is that a good news?
Right.
We tell them this is a natural hormone. This is what your body was making. So it's not making enough. It's like dried up. It doesn't have that juice coming. We're just going to give you medicine which will replace that. When we use the word replace, what is natural in your system, so they're more receptive towards it. The medicine for that is called levothyroxine, which is what the thyroid is making. So we give them one pill a day, and it takes 4 to 6 weeks for the patient to understand, that it's not going to go away. It's not a Tylenol, the headache will go away in an hour. It takes 4 to 6 weeks to see the difference. And we have them come back in 4 to 6 weeks to repeat the blood test so that we can make some dose adjustments. Usually, we basically depends on, how old they are or if they have any other conditions like heart problems. We can start them on a certain dose. If they're older and they have heart problems, we have to start with a lower dose.
Gotcha.
So the funny things, one of our attendings, one of our mentors there in New York where I was trained, he was kind of a very is a great teacher. One of the ways he would say that, hey, these heart problems, if you start them on thyroid medicine, the dose should be very low. And yeah, we know, maybe 25 or 12.5. He said, no, almost like you make them smell the medicine. So, it was so the point was that you will start low and go slow.
Work your way up from there.
Otherwise, what I do, I usually check their weight, ideal weight, and then based on that, that's their requirement. They usually need about 1.6 micrograms per kilo body weight. Then I have them come back in 6 weeks and check their blood weight.
Gotcha. Okay. Well, Dr. Baba, this has been a great conversation to have. Thanks so much for coming in today. Listeners who might be listening in Dyersburg and in Jackson, Tennessee, Dr. Baba is accepting new patients right now. The phone number for both of the clinics that he is at will be in the description of the podcast. Dr. Baba, thanks so much for coming in today.
Thanks, Will. My pleasure.
Absolutely. And this has been another episode of We Talk Health.
Thanks, Will.